Well, we are always bad news for family and patients, unfortunately. Death is not a picnic, and it's not going to be, and we are there to make the suffering, the distress, just a little bit better. One misconception is that people feel that they have to give up on living as long as possible, of life prolongation measures or interventions before they can receive palliative care. Which is not true. This is also one very common misconception among healthcare providers. They feel that, I've got more to offer, there are many more lines of treatments, or there's still dialysis, I haven't considered this, and they feel that it's only when I've offered everything and nothing works that I can offer palliative care. But by that time, it is often too late, and we feel that patients' needs and their families' needs can be much better met earlier on. It should be every healthcare practitioner's responsibility to be able to recognize suffering, whether physical, psychological, social, or spiritual. At this point, we are just seeing them a few days or a few weeks before end of life. We could really make a huge difference if we see them months upstream. Upstream palliative care in various illnesses might look like this. They are doctors, whether it's primary care doctors or specialists, cardiologists or renal care physicians or oncologists taking care of them when they recognize that their illness is serious and it's very likely to progress. Then they either introduce or open up that conversation about getting palliative care team on board so that their care is much more holistic, looking at various aspects and dimensions to help them achieve and to maximize their quality of care, even at the same time as they are trying to prolong their lives. Palliative care can be different things to different people at different times. For example, slightly earlier in the trajectory, I might need encouragement to eat well. I might need information on how I could keep as fit as possible to undergo my cancer treatment. Later on, I may need palliative care to help me with pain control, a control of my fatigue or insomnia, and later on maybe to help me be independent in the home, even with devices in the home. Or later on, palliative care might be helpful in teaching my family how to care for me if I'm bedbound and to take away any symptoms or distress that I might have. So palliative care is just what you need at whichever point you are. To the healthcare professional, I guess palliative care is another layer of support for you as well as for your patients. If you have the sense that the patient's care is more complex, or there's needs that you can't meet completely, or even if it's for yourself, you think that you need a team behind you as you support or journey along the patient's illness, just look for us.